Good morning, everyone. The Bahubalis, the warriors, and the winners, and the great men and women with a wonderful aspirational dream to be the NEET PG Topper. A great morning welcomes you. You are with Dr. Murali Bharadwaz. OnlineMBBS.com quizzes. So we hold almost 4 to 5 quiz tournaments, and as the days progress, we will increase our quiz tournaments to almost 15 tournaments every day. By winning the quiz tournament, you get a free subscription to 40,000 rupees worth of OnlineMBBS.com video library, where you have 3,000 video lectures, 30,000 MCQs of Q scanner, topic-wise classified, 1 lakh PowerPoint slides, and above all, 65 full-scale grant tests every Sunday, along with discussion. So all this, if you become winner. Even if you're not a winner, every quiz will wake you up and tell, these are the topics, hey, you need to read, you need to master. So with that preamble, let's make the great beginning. And those who are joining little late, no worries, just to join our WhatsApp group. If you go to that link which I have given to you, that will enable you to join the, okay, maybe the link is not working. You can go to 9000868 or helpline to request the link. So let us make the great beginning. Yes. A 35-year-old gravida 4 with 7 months of amenorrhea. On examination, pylori is there. So what is the most likelihood possibility? Only 3 of you rightly answered it as multiple pregnancy. Okay. That brings Muhammad Sadiq, Avijit, and Al Khamenei on the top. Question 3. You need to expand. That's the reason you need to play on the smartphone. A 35-year-old gravida 4 who is a known diabetic on irregular treatment presents with 8 months amenorrhea. So considering all the history, very good. It is a case of big baby. 10 of you have rightly answered, a macrozoic baby. Al Khamenei is on the top. We have Basha, Dak, Dr. Kefin, and many more. Good. The next question, question number 4. A preemie with 6 months amenorrhea with sudden abdominal pain, blood pressure is 110/70, pulse rate is racing at 92 per minute. What is your diagnosis? Yes, this is a case of yes, the fibroid uterus. 4 of you rightly answered. Right. Now, the next question. Question number 5. A 36-year-old primate gravida with amenorrhea of 5 months duration. She is found to be having a uterus of 28 week size. Very good. 14 of you rightly answered fibroid uterus. I'm so happy to see 49 online players. Excellent. Al-Kavinaini, Dr. Caffeine, Ron, Dak, and Milky. All of you are right. It will be very happy if your screen names are your actual names. It's enjoyable to call you by your name, right? So, but it's okay. Game is like a real game. A 26-year-old gravida 3 paragiro has 3 abortions between 6 to 10 weeks of gestation. She is negative for the torch infections. What is your diagnosis, doctor? So typically, the first trimester abortions are all because of the chromosomal abnormalities. 15 of you are absolutely right. That is wonderful. So, Al-Kavinaini is on the top. Very good. Now, question number 7. A 35-year-old gravida 3, 38-year-old gravida 3, at 22 weeks of gestation, first pregnancy got terminated as anencephalic fetus. And second pregnancy was intrauterine death at term. So that makes it diabetes mellitus. Only one of you have rightly answered. I don't know what tempted you towards RH incompatibility. Avijit is the only one who has correctly answered. Very good, Avijit. Question number 8. A 30-year-old gravida with a history of abortions at 20th week of gestation presents with a past history of sudden rupture of the membrane and bleeding following expulsion of the products of conception within 2 hours. So what is the likelihood? Absolutely right. This is the story of cervical incompetence. Absolutely, doctor. Excellent. That keeps Shakti on the top. Very good. Shakti was our previous topper from Tamil Nadu. And yeah, I hope it is the same Shakti over there. Good. Tamil Nadu, I think Kerala, I believe. So question number 9. A 30-year-old gravida 3, 7 months amenorrhea, past history of spontaneous abortions at 22 weeks. And the next one was a preterm delivery at 30 weeks. Uterus is 26 weeks in size. Fetal heart sounds are heard. And the fundus. So, considering all that, typically it is a case of uterine abnormalities is what you need to remember. That's good. That keeps Al-Kavinaini, Ron, Loser, Avijit, everyone on the top. Very good. Now, question number 10. A 21-year-old girl comes to the gynae clinic with 8 weeks of amenorrhea. The uterus is 8 weeks in size. Urinary pregnancy test is positive. She wants to terminate the pregnancy. What is the best advice that you want to give? Doctor, that's right. You can do medical termination of pregnancy considering her gestational age. Wow, that brings Milky to the top. Excellent. Now, question 11. An 18-year-old girl presents with a history of being pregnant. She wants termination of pregnancy for social reasons. On examination, the uterus is felt in the umbilicus. So, what do you want to do? Absolutely. Only 2 of you have correctly answered. Doctor, typically the uterus is felt at umbilicus. That is a very important clue, which you should not miss. Dak correctly answered. And who else? Who is that? Chupe Rustum correctly answered. Amita also correctly answered. Very good. So, doctor, you need to remember, at about 3 months, 13 to 14 weeks, the top of the uterus is just above the mother's pubic bone. At about 5 months, 20 to 22 weeks, the top of the uterus is usually at the level of the umbilicus. So, you should know 20 to 22 weeks is not the right time to do termination of pregnancy. Now, doctor. So, question number 12. Meena Tabassum and Bedi Basha. I think Basha already joined. Meena Tabassum should call 9000. Call 9000-868-356. Our helpline will include you into a WhatsApp group. It is our quiz WhatsApp group. Once you get into that WhatsApp group, every time before the quiz starts, we will put the link for playing the quiz. Okay? So it is free, absolutely free, no worries. So please join the quiz along with everyone. So that's good, doctor. That's good. We have 54 players. I'm so happy. Please invite your friends. We are becoming popular every day. And one day I want 1 lakh students, boom, 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 fighting to get onto the top position, playing concurrently. Wow, bahut maza aayega. Right? So, doctor, the next question. Question number 13. The child has moderate learning difficulties, cerebral palsy, growth delay. There was a prolonged jaundice after birth. There are severe visual impairments because of the chorioretinitis. The mother was unaware of any illness during pregnancy. So what is your diagnosis? Absolutely right. Cytomegalovirus. Now, doctor, the next question. That keeps Shakti on the top, followed by loser, Abhijit, Milky, Dak. Oh, come on. Al Khami Naini Saab, aap jara slow ho gaya. Islo nahi hona. Bhagna. Very good. Bhag Milka Bhago. The next question. The child was well for the first week after the birth. Then rapid deterioration started. He now refuses to feed. He is drowsy. He has apnea. And he appears very unwell and shocked with the evidence of neck stiffness. So what is your diagnosis? Absolutely. 10 of you have cracked it. Group B, streptococcus is what you need to remember. 55 players. One more player has joined. Very good. So, doctor, on this YouTube channel also, you please click on the subscribe YouTube to this YouTube channel. Also, please click on the bell button for notifications to be turned on. Every time we are starting the quiz, you get a notification. And in the WhatsApp group, you look at the quiz link. And then play the quiz even if you are in hospital, even with your girlfriend behind a bush, even if you are in the very busy appointment, you can still play the game and be on a day-long revision with Dr. Murali Bharadwaz, right? Now, doctor, the next question. Question number 15. The child developed a blistering rash on the scalp and the face 10 days after birth. The conjunctivae are also red and they are blistered. He has jaundice, he has hepatomegaly. What is your diagnosis? Come on, Doctoro, Italia. Herpes simplex, doctor, not toxoplasma. Yes. So these are all classical clinical vignettes in the NEET PG exam, doctor. Be very sure. You have to sniff the diagnosis. Exam hall जाने के बाद इधर देखना उधर देखना सोचना आइंस्टीन के जैसे कुछ भी नहीं होता. स्पाइनल कॉर्ड कॉर्डल इक्विना लेवल में आप आंसर करना है एग्जाम में. 10 सेकेंड्स 20 सेकेंड्स में फटाफट तीर चलाना और बोलना मैं डॉक्टर मुरली भारद्वाज का सुपर 1000 बैच में हूं. एग्जामिनर को पता चलना पड़ना चाहिए. The speed at which you are punching the answers in the tomorrow's NEET PG exam, computer will recognize, oh, Dr. Murali Bharadwaj, mercenary squad has come into writing the exam. Bolke, they should be able to understand. Okay, that's a deal between us. Now, doctor, the next question. Question number 16. The child developed a purulent discharge of both conjunctivae 8 days after birth. And on examination, there are corneal ulcers, retinal changes. He was otherwise well initially, but he has now developed a cough, fever, cyanosis. What's your answer? Absolutely. Chlamydia trachomatis. Excellent, doctor. Avijit, Milky, Loser, VLS, Al-Khaminaini, Swati. Very good. Proud of you, Swati. Priyank, Sakshi, Prachi, Pravalika, Harita. Whoa. Our Dr. Murali Bharadwaz NEET PG Kung Fu Academy is the Kung Fu Karate Academy is really becoming very hot and competitive every day. A nulliparous woman, 12 weeks gestation, presents with diarrhea, pyrexia, premature labor, unpasteurized cheese, cooked meat. That should sound that clinical minute in your mind. Listeriosis is what you need to basically remember. So many times this question was asked in All India Institute previous exams. So be very sure, doctor. So in the onlinembbs.com video library, you have 30,000 MCQs topic-wise classified from the last 15 years of AIMS, All India, PGI, JIPA, and the DNB. DNB is also a great question bank, and FMG exam also. So once topic-wise you segregate them, and then topic-wise you pick them up and then finish the logic in those questions and cover all 953 topics by spending at least 400 to 500 hours, doctor, maximum investment of your time in NEET PG preparation. If somebody fools you by saying, I read 18 hours, 19 hours a day, Please go and check Decubitus answers. You don't need to read so much for NEET PG, but you need to practice questions. You need to practice in the middle of a competitive mob. That is what the quiz tournaments are. So please don't forget, afternoon 3 p.m. we have our next quiz tournament in the subject of pediatrics. Okay, so doctor, next question. Question number 18. A multiparous woman, 16 weeks gestation, intensely itchy, green-colored offensive vaginal discharge. Oh, I know 55 out of 55 correctly should answer. 55 out of 55 should correctly answer, otherwise I'll cry. Oh, that's great. 26 of you correctly answered trichomoniasis. Now, doctor. But whoever answers fast will get high. Priyank is 90 score. Very good. Question number 19. 19. A nulliparous woman, 8 weeks gestation, painless ulcers on the labia with regional lymphadenopathy. Very importantly, I know most of you will correctly answer. Boom! Oh no! How can you think of LGV? Painless ulcers on labia with regional lymphadenopathy, 8 weeks gestation, treponema pallidum. Now, all-combination सबसे बढ़कर yesterday night topper is Al-Khamenei. Very good. So, doctor, question number 20. 20. A nulliparous woman of 10 weeks gestation is found to have painful ulcers in her cervix and labia. They are shallow. They are painful. She has regional lymphadenopathy. She reports recurrent tingling sensation in that affected area. Absolutely. Classical story of herpes genitalis. Very good. So, Al-Khamenei is on the top. Very good. Now, question number 21. Nulliparous woman of 12 weeks gestation reports a mild glandular fever-like illness. Meow, 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 meow. She has 2 cats in the home. What's your diagnosis? Oh, sorry, doctor. The 4th option was not properly entered. That was the 4th option correct. Toxoplasma. Right. Sorry, 4th option was not given. कभी-कभी जरा typographics होता है, 1-2 questions. Yes. Question number 22. This causes birth defects when the mother is infected with a primary infection versus recurrent infection. Come on. So, there's a easy question. Absolutely. Cytomegalovirus. So it depends. Now, doctor, 23 out of 30. Congenital infection is very rare if you contract this infection 16 weeks before 16 weeks of gestation. Congenital infection is very rare. Which can give you the correct answer. Boom, 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 boom. Let us see. Syphilis is like that. Congenital infection is very rare before 16 weeks of gestation. Wow. Al-Khamenei missed it. VLS is really going top. Very good, Swati, Priyank, Milky, Ron. Excellent, excellent, doctor. Georgita Oh, he's Sikandar. Who is going to be Sikandar for today? There is a 24% incidence of congenital infection when the maternal infection occurred in the last month of pregnancy. Who is going to give me the correct answer? Good. It is the varicella zoster, the chicken pox. There's a 24% incidence of congenital infection when the maternal infection occurs in the last month of pregnancy is what you need to remember. Whoa, that makes Milky come to the top. Anybody can become the topper and get that excitation of instant activation of onlinembbs.com video library. If you're already our previous topper, you can still gift it to your friends. That's what Navina has done recently, gifted to her friend, right? And very good. We have 56 players. मेरे प्यारे भारतवासियों, अपने साथियों को भी लाना, हम सब मिलके जंग लड़ेंगे, ठीक है? So please bring your wonderful friends. I want quickly our quiz tournaments to have 100 plus players by the end of the day. Okay, you should be my brand ambassador to pull more and more to come and play this game. And in order to get that quiz link to play, be part of our WhatsApp group. To become the part of our WhatsApp group, please call our helpline. You know the number, right? So 9000868 Now, doctor, the next question number 25. This infects all infants, 50% of whom will be asymptomatic born to the women who had a recent infection. It is the classical qualifier statement about which infection in the torch group. So every time you become clean bold while answering the quiz, then you find some of your friends really racing very fast. Nothing to get disappointed. You know, that is the whole purpose. You know, you should wake up, you should feel, yes, man. Let me tell you, doctor, any number of coaching programs you attend, any number of video libraries you subscribe, any number of mobile video apps you are in, who has to fight the game? You have to fight the game. Uddharet atmanatmanam atmanam avasadhet atmaina atmano bandhuhu atmaina ripuratmanaha. You yourself is the best friend, yourself is the best enemy of yourself. And you are the one who either can accelerate your preparation or you unnecessarily get disappointed and put brakes. There is no other enemy external. Enemy is lying within us. So kill that enemy within us and grow the friend within us with a positive, brimming attitude. Read every day. Reflect yourself. After all, the challenge is not very big. There are 953 high-yield topics, 30,000 points to revise, out of which about 5,000 to 6,000 lists to remember and buttify. And there are about 5,000 to 6,000 points. Logically, you should understand you have the formula to become a winner. But if you think that I just joined that coaching or this coaching and that is a assurance for me to win, no, not necessarily. Right, doctor? So you are part of Dr. Murali Bharadwaz Super 1000 Academy, right? So very good. Al-Khamenei is on the top. 26 out of 30. A rhesus negative woman had a significant antepartum hemorrhage at 29 weeks of gestation. What do you want to, how do you want to investigate this lady? I think most of you will correctly answer. Yes, absolutely, doctor. Clean hires test is the one which you need to remember. Now, That makes Milky, Swati, Abhijit, Vigabatrin on the top. Very good. Question number 27. 29-year-old primiparous woman presents at 35 weeks with itching. Itching. Come on, doctor. Now you know the diagnosis. So, acute fatty liver of pregnancy, cholestasis of pregnancy, HELLP syndrome. So, you should know the 4 causes of jaundice in pregnancy. Favorite area of examiner. Bile acids. Absolutely right. Very good. Milky, Abhijit have snatched the crown from Al-Khamenei. Still, there are 2 questions. We will see who is going to be the 40,000 rupees winner in this quiz tournament. Question number 28. 35-year-old multiparous woman, blood pressure 160/95, 1 plus protein excretion. But our doctor, how do you want to evaluate? How will you evaluate preeclampsia? All of you should correctly answer. 24-hour urine protein excretion first need to be evaluated. So, Milky is rocking. Al-Khamenei quickly is running forward to get back his crown. Let us see who is going to get the crown. Last 2 questions are going to decide the crown. Shankar Prasad, Harshit Gupta, Jyoti, Amrita, Dheeraj. We all missed your presence maybe. Maybe you could not get the link. 9000-868-356. Please call this link and then ask our helpline to include you into our quiz WhatsApp group. Already we have almost 100 plus members in that, in our quizzing committee. So you also join. Before the quiz starts, we will put the quiz link. Okay? Afternoon 3 o'clock, you should not miss. Shankar Prasad, Harshit Gupta, Jyoti, please join our quizzing group. Very good. 23 of you are right. That makes Milky Al-Khamenei having boxing show. Let us see. But Ron answered very fast. He got very high marks. The last question to decide. The triple test of a 25-year-old woman has shown that her baby is at increased risk of having Down syndrome. How do you want to evaluate, doctor? I know all of you will answer this correctly. Punch. Yes. Whoa. 29 of you have correctly answered. Absolutely. That keeps Milky on the top. Milky is the winner. Milky gets Milky. Excellent. And Milky, you need to call our helpline, send this screenshot. I am the topper of Dr. Murali Bharadwaz online MBBS.com video library, 40,000 rupees prize winner. So, doctor, thank you all for really vibrantly participating. Almost 58 players. So, we will once more meet at 3 p.m. with pediatrics quiz. We will all meet at 7 p.m. with psychiatric quiz. And at 9 o'clock, Dr. Harita, pathology with Dr. Harita at 9 p.m. Right? Shortly, we have an excellent teacher called Dr. Apeksha Sharma, who is from Jaipur, obstetrics teacher. In fact, obstetrics gynecology quiz with Dr. Apeksha would be a delightful pleasure. And orthopedics quiz every day in future is going to be held by Dr. Ravi Kiran Sir. So like that, for all 19 specialties, I'm going to get 19 great teachers who will work like a quiz master. Almost every day you have 19 quizzes and 19 students get a chance to each win 40,000 rupees worth. Almost 7-8 lakhs worth of online MBBS.com video library access will be given every day. So keep reading, keep reading, keep reading. And that is the only way, doctor. There is no other way to become the topper. Not even a single day before exam, you should lose that or dilute the dream that you are the topper when the results come, right? I'll be waiting when you all will be sending me laddu in the WhatsApp saying that, sir, I got first rank, second rank, 10th rank, 100 rank, right? So I'll be waiting for that. For that next 6 months, we all have to hold each other's hand and then move forward, preparing every day. Enjoy a great afternoon. Thank you.